So, how do I make headaches go away in the patients that I see in my practice? I'm going to share with you my theories about the causes of headaches and the specific therapeutic methods I use coming up. Hey guys, what's going on? Dr. John Blenio here with High Amplitude Health, helping you understand your body and helping you know what to do when the aches and pains start to show up. And on this channel, I talk about specific problems that might be going on with your body, what I do to resolve those problems for the patients I see in my practice, and I even teach you how to resolve some of those problems all by yourself. So if you're new here, consider subscribing. One of my patients recently asked me, why do I get headaches? Well, here's my theory for most of the patients I see at High Amplitude Health. Most headaches are caused by muscle tension in the upper back, the shoulders, and the head. And of those regions, the muscles in the head are the primary cause, number one, of headaches. So how do muscles in the head cause headaches? Let's go to the anatomy. All right, so here we are looking at the anatomy. This is my little three-dimensional diagram that I have here. It's really cool. So I'm going to flip this around. Let's first look at the trapezius muscles. I'm going to multi-select here. This is a big muscle on the back. We all know what our trapezius is. We do shrugs in the gym and we work those out. These muscles get a lot of work. And if you look where they attach right to the base of the skull. So the trapezius muscles, upper back, are quite often involved in headaches because the tension and tightness that occurs within this very big and powerful muscle translates right up into the base of the skull, which can cause problems. Now I'm going to hide that, and now we have these neck muscles right up here. Those underneath get very tight, and look where they all attach, right to the base of the skull. Okay? So all of these muscles, when they get tight, can really create a lot of tension within the head. And let's hide those. We also have muscles called suboccipital muscles. And these are all right there at the base of the skull, really fine movers of your neck and your head. And when all of these muscles that I'm showing you get very tight, they translate, literally translate up into the skull. So here is a head muscle, and this is the occipitofrontalis muscle. So this actually is a muscle here in the back, and then this is all tendon from here, and then if we come around forward, we've got the frontalis muscle right here, this red part. Okay, so think about all of that tension that was going on in the traps. I pointed that out. The muscles in the neck where there was lots of muscle tension, and now all of that is translating upwards into the head to the forehead, okay? Now look at all of these muscles in the head and the face. Tension that occurs within muscles causes other muscles around it to become tense and to become tight. And when this muscle becomes tight, and this muscle around the eyes becomes tight, and these in the face, and around the lips, and we chew and we eat and we talk all day, and these muscles that are chewing muscles become tight, and all of these talking muscles become tight. The next thing you know, we start to feel headaches. But there's a specific reason why we feel headaches. Okay, all of these muscles are getting tight. And oh, let me show you one other thing here. If we, there's muscles in the eye. I'm going to zoom in here, way in. See that right? See that dark line there? That's a muscle. That's one of the muscles that actually helps your eye turn left and right. There are more of them for going up and down, okay? So you've got muscles in the forehead that are tight. You've got muscles around the eyes that are tight. Right here in what would seem like our sinuses, we often feel pain with headaches. We feel up here in the temple region, that's where headaches are. All of these muscles become tight in the head and they start to cause a problem. But why would tight muscles in the head cause such a problem? Here's another theory I have. So I'm going to hide all of these. And now look. Now we're looking at the skeletal system. These bones. Here's a bone. Here's a bone. Here's a bone. Let's come to the back. Here's another bone. Let's come to the side. Here's another bone. All of these bones are supposed to have a little bit of play in them. I'll use my fingers here, but they have these things called sutures. So if we zoom in, you can kind of see there's space in between where these joints meet. The skull is made up of quite a few different pieces of bone, which are the assembly for the skull. And there's supposed to be a little bit of, you could say microscopic movement at half a millimeter in size. I'm not exactly sure this is a theory, but what I do understand is these bones are supposed to be able to move a little bit. And when all of those muscles become super, super tight, they bind and lock what are little joints into less movement or no movement. And they essentially render the skull immovable when it's supposed to be able to flex and move with pressure changes that happen on the inside of your body. So if we think about all the muscle tension that occurs in the upper back and the shoulders, and it translates up to the head, and then it just causes all of these muscles in the face to become tight, and then render all of these separate bones of your skull somewhat immovable, then the pressure changes that occur within your body relative to atmospheric pressure those joints don't move properly. And a lot of people just get chronic headaches that they can't get rid of. And I think when we address all of those muscles around the head, that's how I make headaches go away. And I have many, many patients whose headaches I've resolved pretty much completely. Patients who have seen neurologists at Stanford University, they've seen physical therapists, they've seen massage therapists, they've seen everybody, and nobody knows how to get their headaches to go away, but they come and see me, and next thing you know, I start applying pressure to all of these muscles around the head and release them, which creates more elasticity and creates more pliability and movement with the muscles, thus allowing the cranium thus restoring the little bit of flex that's in those sutures that you see there. They're supposed to have a little bit of fine movement, and by getting those muscles to relax, the headaches go away. So I got a little bit technical there. You were able to see the anatomy as I was describing it. You're able to understand that muscles are the primary cause of headaches, and that it is tension that occurs within the trapezius muscles, some of the shoulder muscles, the neck muscles, and primarily the muscles in the head. I did not mention the jaw as I was explaining it. I tapped on some of the muscles around the jaw, but think of things like TMJ. A lot of people get TMJ because they clench their teeth at night when they sleep. Imagine biting down all night or for even just a couple hours, how tight and fatigued these muscles in the jaw would get. Imagine that. That will affect how the TMJ functions because the muscles are bound up. Nothing moves freely. So TMJ problem, people who have TMJ problems quite often have headache problems as well. So when I get in there and I start applying pressure and releasing all of these muscles around the face and in the head and the back of the neck and everything, my patients get better. I make headaches go away. Okay, so a little technical, a little long, but I resolve headaches. If you're getting them and you're watching this video right now, come see me. I know what to do. Until next time, keep taking care of your body. Find good doctors, exercise, get preventative care, eat well, foam roll, do all of those things to take care of your body. You've got one temple, take care of it. Keep crushing it, and I'll talk to you soon.